Hello, I'm Dr. Ahn Tae-Hwan, an ear, nose, and throat surgeon. My main specialty is nasal surgery, but over the years I've also performed many stem cell procedures. And naturally, that led me to perform quite a number of liposuction cases as well. As I treated more patients with fuller, rounder faces, I began to think deeply. How can we safely and effectively reduce facial volume? From the early days, I used AccuSculpt, Venus laser, and ultrasound-based systems like ELSA. Today, I mainly work with APOLEX Tite, developed by CHUNGWOO Medical. Throughout history, there have been many fat reduction devices. However, facial fat treatments often lead to uneven or lumpy results. Just as in body lipolysis, melting and suction must be balanced to avoid irregularities. The same principle applies to the face. Today's presentation is not about plastic surgery concepts, but rather about how to apply APOLEX Tite easily and safely in dermatologic practice. APOLEX Tite is an effective monopolar radiofrequency system for fat melting. You may know the Israeli device FaceTite, which uses bipolar RF. It can liquefy fat, but it requires expensive consumable tips, about $400 to $500 each, and it carries a relatively high risk of burns. In contrast, APOLEX Tite uses Monopolar RF. To compare, Thermage operates at 6.78 MHz using a reverse thermal gradient concept. The skin surface is cooled while heat penetrates deeper to remodel collagen. APOLEX Tite, however, works at 500 kHz, a lower frequency delivering gentler energy, and its greatest strength is the real-time temperature sensor. FaceTite also had a sensor in the past, but it was discontinued due to frequent burns and safety issues. When I tried APOLEX Tite, I immediately noticed how efficiently it melts fat without complications. Ultrasound-based systems like ELSA also work, but they create vibration, which often causes burns near the entry point. Because APOLEX Tite uses monopolar RF, it produces uniform heat distribution without vibration. Originally launched overseas, it's now available in Korea and has shown excellent results for submental fat, nasolabial folds, and lower face contouring. For proper submental contouring, liposuction should sometimes be performed together. The patient satisfaction rate is high, but it's not a simple petit procedure. It requires professional precision. APOLEX Tite works beautifully with other EBD devices such as Ulthera or Shrink. Ideally, these should be done 3 to 4 weeks later. If performed on the same day, you must lower the RF energy significantly. In thread lifting, patients with heavy facial fat often see limited results. However, when combined with APOLEX Tite, the outcome is greatly enhanced. The built-in temperature sensor prevents overheating. Once the tissue reaches the set temperature, the device automatically stops delivering energy. That makes APOLEX Tite a safe and reliable system. The target layer is the superficial fat, not the deep layer. Around the zygoma, the facial nerve runs superficially. In the lower face, it's deeper near the SMS. Some doctors worry about the marginal mandibular nerve, but temporary facial weakness is usually caused by tumescent infiltration, not nerve injury, and it resolves within a day. In reality, damaging that nerve is extremely rare. In patients with previous liposuction, adhesion may make the procedure difficult. In such cases, use a 23 or 20 gauge cannula for blunt dissection. Facial nerves exit behind the ear and lie deeper than the target fat layer. So, treatment is safe and straightforward. Deep fat lies below the muscle and is not the target area. Our focus is the superficial compartments, the nasolabial fat and prejowl fat pads. Each treatment zone takes about 2 minutes. 4 zones take around 8 minutes, and if tightening is added, about 16 minutes. If tightening is skipped, HIFU can be combined instead. The main target areas for treatment include the nasolabial fat and the superior jowl fat, essentially the lower facial fat compartments. For patients with heavier facial fat, using a 3-hole cannula for gentle liposuction can produce excellent results. In younger patients, the septa and ligaments are strong enough to hold the fat pads in place. However, as we age, these supporting structures loosen, and the fat gradually descends, leading to sagging and loss of contour. The facial nerves include the orbital and mental nerves, among others. Although nerve injury can be a concern in facial procedures, with APOLEX Tite, it is extremely difficult to cause any nerve damage, so there is no need for concern during treatment. The lower face nerves are located deep, while the upper facial branches are more superficial. As facial sagging increases with age, the most effective approach is to selectively melt the ptotic fat pads rather than removing too much volume. When I explain the procedure to patients, I often describe APOLEX Tite as an inside thermage. Because it delivers radiofrequency energy directly beneath the skin, it both melts fat and tightens tissue at the same time, creating a much stronger lifting and contouring effect. A gentle application along the nasolabial folds also helps tighten the area and improve the overall definition. My Tumescent formula is as follows: normal saline 100 milliliters, lidocaine 20 milligrams, and epinephrine 0.2 milligrams. Proper tumescent infiltration creates a working space and significantly reduces the risk of burns. Radiofrequency energy flows through the tissue, and heat is generated by impedance. Because subcutaneous fat and fibrous septa have high impedance, they retain heat more effectively. That's why Monopolar RF technology has become so popular. Being a Monopolar RF system, APOLEX Tite is a powerful and versatile tool that can be a strong addition to any clinic's portfolio. The RF energy liquefies fat cells, initiates a controlled wound healing response, and stimulates collagen regeneration. Thanks to its temperature and impedance monitoring, the system automatically maintains a safe and consistent level of heat. Clinical photos clearly show that fat melting is uniform and smooth. The device is effective not only for the face, but also for the abdomen, upper arms, and thighs. On the left, you can see results with APOLEX Tite, and on the right with manual lipolysis. The APOLEX treated area shows much more even and consistent fat liquefaction. This published study demonstrates that APOLEX Tite is safe and effective for submental contouring and lower face tightening, and that it may serve as a non-surgical alternative for facial rejuvenation. EBD devices such as Ulthera or Shrink should be performed 3 to 4 weeks later, or if done on the same day with lower energy settings to ensure safety. Because RF emission occurs only at the cannula tip, the risk of burns is extremely low. While thermage operates at 6.78 MHz and 400 watts, APOLEX Tite works subdermally at 500 kHz and 50 watts. Although the energy level is lower, it is more than sufficient to achieve noticeable results. 3 handpieces are available: 0.8 mm, 1.0 mm, and 3.0 mm. For facial treatments, I use the 0.8 mm cannula for the submental area, 1.0 mm, and for body areas such as the abdomen, 3.0 mm. The device features an LED indicator and a temperature sensor, which help prevent overheating. After melting the fat at the preset level, I slightly lower the power to perform one more tightening pass, which produces an even better result. Combination therapy works very well with thread lifting and other EBD devices. If you lightly melt the facial fat first and then perform Shrink, you will see a marked reduction in volume. Because the effect is powerful, there is a risk of over-reduction, so proceed carefully and apply your own clinical judgment and technique. APOLEX Tite is minimally invasive and can also be performed as a standalone procedure. Like thermage, the typical treatment cycle is once or twice a year. Here is a submental case. The upper photo was taken June 17th before treatment, and the lower one June 21st after treatment. You can see clear improvement in contour and tightening. The middle case is a Thai patient, and the last one shows LPGA golfer Park Hee-jong, who received APOLEX Tite combined with liposuction for enhanced definition. The next video features 2 patient cases similar to these. Today's procedures will be done under sedation, but can also be performed comfortably with only local tumescent anesthesia. In one case, we will perform both melting and suction. In the other, only fat melting. Each treatment takes approximately 4 minutes. Thank you.